I would like to just say a few things. In Afghanistan, we are trying to provide education, try to train people to be a midwife and a nurse. But although we don't have human resource, but the system is so difficult because they are demanding that the nurses or the midwife has to go through this long educational processes to be a nurse or to be a midwife. While on the field, we really need somebody that really can go to somebody's house and be able to deliver that baby with little knowledge that we could give that person. And that person can do the job, but could save that life. But unfortunately, the system is not allowing that individual to go with that little knowledge that we give it to her to save that life, because the system is so difficult, is making difficult. But NGO is trying to really provide nurses and midwives to go to people's houses and to save life. But we are really shorting. But although as much as we short and nurse and doctor, but the system is not allowing us to do it.
Angela, I might just bring you in and talk about some of the community-driven reforms that you've worked in, and indeed our speakers are obviously very passionate about as well. But you in Laos and in your work through Southeast Asia had that experience that ultimately, unless you give the community the power over what it is that they're doing, I mean, ultimately your aim as an aid worker is to make yourself redundant, is to actually not be there at all.
That's right. And it's interesting, I see a real nexus of education and health. I've seen that in my work in integrated rural women's development through sexual health and family planning, because education was always the first thing that the villagers asked for when we went in. Education, education, education. So, but of course the children can't go to school if they're sick, and they're often sick because of preventable diseases or poor water and sanitation. So one thing leads to another, and projects start to become much more responsive to need. And we need projects and we need funding to be able to be flexible to respond to those needs as they emerge. But the example that always stands out for me about why we need to listen to communities and why as aid workers we need to go in with a sense of humility and a sense of needing to learn. And this is a very grassrootsy kind of example, but in the villages we were working, one of the objectives was to get people to pen their animals, pen their pigs and their chickens and things that otherwise ran around the village and, you know, made the village pretty messy. And it was a public health and hygiene strategy, and it was supported by government policy. And we would go into villages to monitor progress of the project, and we'd walk in the village and the animals would be running around, and we'd talk to our project teams, you know, what do we need to do to make a difference? And they'd say, well, we have to keep telling the villagers to pen their animals. We have to keep telling them it's government policy. And then we introduced a participatory evaluation that was really about, you know, asking good questions, getting people to be comfortable telling us what was really going on. And what emerged was that there were two different issues going on in the villages. One, the villagers said, well, we don't have latrines, we don't have toilets. So the foraging animals actually keep the village and the surrounding area clean of human excrement. Okay, very logical use of animals. But it also gave us then the leverage to go in and say, okay, latrine building, that becomes another part of this project initiative. In the other case, the villagers were actually, the village that they lived was a village they'd been forcibly relocated to. They were an ethnic minority people who traditionally practice Swidden agriculture, which is slash and burn. And their real village, their heartland, was up in the hills, a 3-day walk from the village they ostensibly had been allocated by government. So they weren't penning their animals, because if they left their animals in pens for the amount of time it took them to march up the mountain, do their farming and come back again, the animals would have died of hunger. And that was a harder issue to address because it cut against government policy, but it spoke to at least starting to hear the voice. And we were working with low-order government officials, but for them to be in a position where they heard the voice of the villagers and started to perhaps question the authority of a central policy, just starting to chip away at that. And so there were a couple of very practical examples about why we need to, as I say, go in very humbly into these environments and see our role very much as resourcing local people to respond to the challenges and take control of their health and life, rather than seeing ourselves as any kind of experts.
And also the complexity of the issue and I guess the number of levels that you need to be working on at any given time. You've all said education is the magic wand, is the silver bullet. If education is the answer, why is it so hard to achieve the sorts of things you're aspiring to? Either of you, anyone?
Well, I think that, again, for me specifically, I have been doing this for 20 years now, and education is, I think, that is the solution for it. It is it's not hard to do it, but there is a system that is stopping us, for example, to get that education. For example, I will just tell you, we start a literacy program. Somebody who doesn't know how to read and write, and we design a fast-track classes. That means that from in 1 year they can go in 3 grade level higher. In 2 years they finish 6th grade, and by 6th grade they are able to read and write, and by 6th grade they will be able to take hygiene program, take a prevention method to how to cure the water, how to cure the environment to be cleaner, and how to do the hand wash, and to be able to take some hygiene procedure to be able to save life. So for us, for me as an individual, I think that is wonderful. We should do that, and we will do it. And we send that individual to a village and will be able to. But as a system is not allowing that. The system says, well, this person has to finish 12th grade, then has to go through nursing program to be able to do it. So this is something that we are going around, and we do it because we see that people are dying every day. We have no choice. So education is the issue, and it's easy to do it, and we are doing it. But if you really want to go to the formal way, we have a problem. Yes, we need doctor, but we don't have doctor because we cannot produce doctor. Doctor has to go through higher education, and to go through higher education, then they have to go to those steps. And in order to go to this step, we need money, we need funding, we need resource, we need, again, a system and leadership, and we don't have it.
Dame Carol?
My background is actually education. I'm an educationist by profession, a secondary teacher and a curriculum writer. And when I had the privilege of being thought about for a ministry, many people thought I would want the education ministry, but I taught in that, and I knew that it alone was not the solution, as far as I'm concerned, in Papua New Guinea. So many people were not even getting into it, access, for various reasons, and so many people were being pushed out by a system of exclusion through examinations, etc. And so that's why I took on what was called the Too Hard Basket, the Ministry for Social Welfare and Development, renamed it the Ministry for Community Development, and I had a wonderful, wonderful secretary and senior management staff. I asked them to completely rethink the whole thing, and we're working on education through flexible learning models. And the linchpin at community level is fostering and enhancing and facilitating, strengthening the community learning centres that are already happening out there. People don't lie down and die and give up. They respond to their problems. They're extremely resilient, and they're also, already we've got a directory of thousands of learning centres around the country, women's centres, whatever. So we've been working, and we're still working. It's a long way. We've had rollouts so far in 13 districts, and we've got 89 districts altogether. But 13 districts means 13 of 20 provinces, on trying to establish district focal points for community learning in partnership with education, in partnership with health, to bring flexible learning models to people. The big challenge now is policy issues of how can people move from that flexible learning into this system that says you've got to sit in a classroom for 8 years before you can go up the next step in the ladder. Crazy stuff. How can we have a community learning certificate? And that's the next policy thing to work on, so that people can move through. So it's critical, and looking at appropriate learning for the needs of the communities. Yeah.
So Gus, would you see that as one of the greater obstacles that you've observed in trying to implement the global work that you do?
I've thought that our two distinguished women speakers have skirted around what is, to me, the central problem. To me, the central problem is that male-dominated societies are not as passionately committed to the education of women and girls as everybody in this room is. I think it's a big problem.
Maybe we might add that decision-making in most nations is dominated by males. I am 0.9% of the Parliament of Papua New Guinea. So maybe we have to change the decision-making balance also in our nations.
Well, we're grateful, Sir Gus, that you've become the token bloke for the evening, so
yes.
Thank you very much for that. Angela, you're sort of nodding too, as this has been an experience of yours as well, and I guess there's a lot of people nodding in agreement in the room.
I think one of the challenges, to go back to that greater question that Sir Gus posed before about, what do we do about these inequities, the poaching of talent from developing countries, and I was tempted to paraphrase my character and say we must eradicate poverty. But I don't want to be trite about that. I think that is a huge challenge, and I also concur with Sir Gus that in the last 10 years we have seen real progress. I've seen the HIV epidemic in Southeast Asia turn around from a time when it looked like, just appalling and terrifying to being something that's almost being managed as a chronic illness. So I think there's real signs of hope, but we as a community in Australia really need to keep up the pressure on our government to continue to increase the percentage of GMP that is committed to international aid. It's not very much at the moment. It should be more. And I think we also have a real empathy deficit in this country, and we see that most vividly in policies around asylum seekers, but also I think there's a continuum that connects that to international aid. And I guess I see in a small way my role as a writer is to try to humanise the big picture stories and the statistics, to try and give people an insight into the kind of humanity that we're talking about, and to try and bridge the gap to see that we actually have more in common than what sets us apart. So I think part of our challenge is to build, and that's why it's so inspiring to see a room full of people like this tonight, is to build the groundswell to see political leadership and strength and support so that you see real investment at the level that it's needed in countries that are disproportionately far less wealthy than Australia, not forgetting that the reason why there are developed countries and developing countries has its origins in colonialism, and it's got nothing to do with the human resource in those countries or even the natural resources in a lot of those countries. And I think we have a historical debt to repay in that respect.
I'd like to make a comment too on the brain drain factor, which has become very significant in the Pacific region as well. I believe almost half of our qualified doctors, are now serving overseas, not in PNG, and you can't really blame them because they're wanting the best possible opportunities for their family. But there's also the brain drain factor internally as well as cross nations, where now with the major PNG LNG project, this massive corporate sector investment coming on. I spoke to an administrator down in Milne Bay, a long way from the PNG LNG project. I said, I guess it's not affecting you too much down here. And he said, hey, don't kid yourself. I've already lost 5 of my top bureaucrats. We have teachers leaving the classroom to go and be security workers with the PNG LNG. We have often some of our best staff end up in the development industry, working in AusAid and places. And we can't stop this, but it is a significant issue that we have to be aware of. And so an already perhaps weakened system becomes more weakened. And we talk about failed, fragile states. Well, maybe we're all contributing to the weakening of those systems by this brain drain away from the government systems.
We do have a short amount of time left this evening if people do want to ask questions of our panel. There are some roving mics, as I understand, and I'm staring into sort of lights and shiny things, and I'm not sure where the microphones are. But whilst we find one of those people with a question, I might just ask Dr. Sakina just one last question before we go to the floor. And I guess it's a delicate issue in this country at the moment, with our own country's involvement in your country on a military level. But I guess the kinds of things that you're talking about, how would you see the need for, I guess, the stability, the political stability in your country to contribute to the aspirations that you've got for the education of particularly the women that you're involved with, and how do you see, I guess, the military backdrop around that kind of playing into it?
Thank you. I really strongly believe that the people of Afghanistan deserve that the NATO ally stay for a while in Afghanistan, and to really, in order for the people of Afghanistan to have the opportunity to rise up. Because for the 9 years that our country is struggling, still we didn't get the training and the service that we needed. This last year they are starting to give us some training, because I think the people of Afghanistan could not manage it without training and without job skill, because right now poverty is all over Afghanistan. Women of Afghanistan is trying. There is a lot of good things is happening in Afghanistan, but the security is not allowing people to go from state to state. So we really are in trouble if we want to go from different province to different province. We are not able to because of security issue. But if the security is allowed, we could reach out thousands and thousands more. And that is one thing that I really believe strongly, that the people of Afghanistan deserve to be listened to, and to civil society really are the victim right now in Afghanistan, especially women and children.
Okay, I think we do have a couple of questions from the floor. We've got about 10 minutes left, and we do have to finish pretty promptly on time. So if whoever's got a microphone could stand up, great. Thank you. And
my question is for the panel. What would the panel's comments be for the notion that improved healthcare in developing countries, such as in Africa, will simply augment the population growth and sustainability of it?
I think I can take that one, because fortunately, to your important and frequently asked question, there is a very simple and 100% dead set sure answer. The way to control population is not through increased death rates. The way to control population is through decreased birth rates. And time after time, example after example of countries in transition has shown that as you can lower infant mortality rates and mortality rates generally, so communities who are not stupid voluntarily reduce the number of children that they have. One of the reasons why people in developing countries that are really poor have so many children is that they want to make sure there is at least one son, I'm sorry to say it has to usually be a son, to survive, so to look after them in their old age, because there's no other social security system. But, demographers are absolutely united on this point, that the raising of death rates is not the way to control population growth.
Thank you, Sigas. Yes, we have another question.
Is it on?
Yes, that is on.
Thank you, and thank you for your informative discussion. It's very, very helpful and useful to hear all you've got to say. I'd be interested to know what you think of the model that Cuba has been presenting the world of in the last 5 or 6 years, and the example of East Timor, where they have sent 400, I believe, doctors to far and remote places to practice medicine in places where people have never had medical practitioners before. But more importantly, they've taken 800 people, young people, across to Cuba to train them in the medical profession. And to me, it's a very, very strong message of where there's a will, there's a way. And this whole paradigm that we're involved in with international aid seems to be very piecemeal by comparison. That's my opinion. I'd just be very interested to hear what members of the panel think about that model and whether there's any hope that the Western countries might be able to produce something of equal standards.
I'll have a go at this and I'll shut up for dead set sure afterwards, because I have just come back, literally just 48 hours ago, from Rio de Janeiro, where I spent much of the time sitting next to Sir George Alain, who's from Barbados and who ran the Pan American Health Organization for a good many years. The occasion, by the way, was a celebratory symposium for the 30th anniversary of the eradication of smallpox, and its purpose was to ask, what 30 years later have we learnt, and how can we use the smallpox eradication to do better with other diseases? And I asked Elaine, what did he think of Cuba? He said, well, of course, it's clearly the best health system in the world. Why is it the best health system in the world? It's the best health system in the world because the dictator makes community health, and for that matter, community education, a top priority. As simple as that. Cuba has one of the highest immunization rates in the world. It has remarkable mortality statistics for a very poor country, and therefore I'm 100% agreeing with you. If there is a political will, there is a way. It doesn't need immense riches.
Thank you, Sir Gus. Thank you for that great question. And yes,
can I just add very briefly to that? I think that we. And this is kind of a call out to the funders again and to the NGOs in the room, that we need to get better at evidence-based programming. I think the piecemeal point is very true, and we need to be looking to examples like Cuba as a model that can be applied elsewhere and that have been subject to rigorous evaluation, like Sir Gus has mentioned, where you can actually see the impact in terms of indicators, not just the number of people trained, but the impact that it's had on health and on mortality and morbidity statistics.
we have got time for one last question, I've been informed, and it's you. Yes, hello.
Do you know about the existence of RAWA, Revolutionary Association of Women of Afghanistan? And could you speak about it, please, a little bit?
Okay.
Thank you.
Yes, I do know the organization. I know about them. They are very active. But I personally I am not involved with their program, but I know of them, and they are working in different level than I do. Yes. Thank you. That's all I can say.
Okay. I've been instructed by the Sir on the panel that we should take another couple of questions, so let's follow the token bloke's advice and take a couple more questions from the floor. Yes, that gentleman up the back, thank you.
Hello. My question for the panel would be, so what connection do you see, or what connection can you establish between issues of food insecurity and the disproportionate divisions of food, within the developing countries and, provision of healthcare?
Who would like to take the question?
Carol.
I didn't hear it properly.
Food security. The
food
relationship
security.
between food security and distribution of food in developing countries and its impact on health.
Yeah, I don't think... I'm not a health person, and I don't think I should be taking that one. I think Sir Gus should be taking
No, I promised I'd shut up.
Yes.
Got to give everybody a fair go.
I actually didn't catch the crunch of it.
Well, my question was that what connection do you see between disproportionate division of food in third world countries, what we call food insecurity, and provision of healthcare? What connection do you see between nutrition and healthcare?
Yeah. That might be a question. Oh, okay.
I'll say something. I think with Papua New Guinea, you can see it in the sense of not the food security in sense of food availability, but in the nutritional levels of the food availability. There is a definite relationship. And I don't want to say much more about it but that's so, like I talked before about the protein deficiencies in some of the areas, yeah.
Sakina? Yeah.
Yes. For example, in Afghanistan right now, people are living in poverty. And when people live in poverty, they don't have enough. How about nutrition-wise? They don't get anything. So, and according to that, people are sick because they don't have enough. And when people don't have enough, they are sick. So we have to look into poverty to get rid of poverty to people be healthy. And we are trying to provide a skill training that they have job, that they be able to support themselves, and then they will be healthy. That's it.
And the huge increase in, say, the urban areas that are emerging of, again, the people in poverty have a diet of rice, usually with very little protein or anything, and tea with a bit of sugar, and then the non-communicable diseases where sugar is taken in excess, all of those things are coming in too. And so there is a whole issue there too, a new dimension that we're having to deal with.
I think food security is one of the pillars of primary health care, and the United Nations itself has recognised that a back-to-basics approach is really called for at this moment. And all of the initiatives that we've been talking about on the panel tonight fit in the primary health care rubric. Family planning is there, vaccination is there, improved access to safe delivery for women is there, education is there, water and sanitation. And these are fundamental building blocks. So there's a situation in Cambodia I'm aware of where villagers have access to state-of-the-art antiretroviral drugs for their HIV, but they don't have enough food to make those drugs effective.
Yeah.
So we really need to go back to the basics of primary health care in programming to provide the kind of foundation for a whole lot of other initiatives.
I'll take one question here too. Thank you.
Thank you very much. This is for all of you of the panel. From your position as distinguished and international leaders in education, health and community development, is there something you are doing to create a call for action in Pakistan right now?
I can answer. Yes. For example, right now we have a program in Pakistan, and we are not a humanitarian organization, but because the situation is so bad right now and people are suffering so much, especially right now, there is 1.5 million Afghan refugees in Pakistan and they are suffering through this flood. And we are trying to provide assistance for them, such as cooler for water and bucket of cooked food, delivering to them to try to give them assistance. That's the action that our organization take place. As soon as we find out that the Afghan refugees, especially, nobody was reaching for them. Of course, the Pakistani community are all of them are in trouble. But millions of dollars, if it's going, it's at least get to some people, but not to the Afghan refugee. So that is the action we took place right now. We are serving the people of Pakistan. Yes. Thank you.
Did anyone else want to take that question?
Well, it's sort of like where do you start and where do you stop on that question. I think the main thing is do something. Yeah. Don't do nothing. It's like Gandhi said, be part of the change that you want to see. And I think if you look at these esteemed speakers here and the circumstances that they've talked about working in, we have no excuse not to do something. That's all I would say. There's plenty of options out there. Do something.
And that might be a good place to leave the conversation. Could I just thank you all for being part of what's been the 26th forum in the National One Just World series, which looks at key development issues affecting members of the global community. This one, of course, held in conjunction with the Melbourne Writers' Festival, Melbourne Conversations and the University of Melbourne. Tonight's forum, you might have noticed that there are cameras in the room. Tonight's forum will be screened on ABC's Big Ideas program, so you can look for your program guides to see that. You can also see it on the One Just World website, the Melbourne Uni website and Slow TV websites in the next couple of days. The One Just World website, if you've not been to it, it's worth a squiz, www.onejustworld.com.au. You can register via their website for updates, all sorts of information about upcoming things. You can also add your comments and suggest ideas about other things that you might like to see the organisation be involved with, and just feel like you're part of a community that, as Angela's beautifully articulated to finish this conversation tonight, that you know, if you want to live in a better world, then you've got your own responsibility to take some charge of that and be part of it to build a more just and equitable future. So thank you to the partners in this forum, the International Women's Development Agency, AusAid, World Vision Australia, the Melbourne Writers Festival, Melbourne Conversations, and again Melbourne University. And also please thank our wonderful speakers tonight, Sir Gus Nossel, Dr. Sakina Yakubi, Dame Carol Kidyu, and Angela Savage. I'm Tracy Hutchison. Thank you so much for coming out on a wonderful night, and I'm sure our guests will only be too happy to continue the conversation with you. Thank you very much, and thank you to Paul as well for signing through the night. Thanks so much. Good night.